Welcome to today's press briefing. With us are two doctors, Dr. Chong Sok Kwan, Head of Communicable Disease Branch, CHP, and Dr. Larry Lee, Chief Manager, Hospital Authority. The two doctors will bring us up to date on the HA situation and the COVID situation in Hong Kong. Dr. Lee, please. Fellow citizens, there are 2,453 COVID patients in hospital, and 339 are new admissions. For the isolation facilities, 451 are in isolation ward, 182 in second-tier isolation wards, 599 are in the Lantau Hospital ICC, 177 in the other facilities, and 248 are new admissions. There are 10 patients in critical condition, 9 in serious condition. For the 10, 4 had 3 shots, 3 had 2 shots, and 3 no record of vaccination. For the hospitalized patients, 43 are in critical condition, 41 in serious condition, 13 of the critical conditions are in the ICU. For the deceased patients, there are 10 reported today, 8 male, 2 females, 62 to 99 years of age, and 6 have under-vaccinated, and 5 had 2 shots, 1 didn't have any record of vaccination. There are not patients from the care homes. For the 10 deceased cases, 5 have to do with the COVID disease, and 5 are in doubt. 99-year-old female with 2 shots, August 22nd, she was admitted to QEH, fever, shortness of breath, and low oxygen in blood, PCR positive, and she needed oxygen, and her condition deteriorated on August 27th. She passed away. Next, 85-year-old male with 2 shots, diabetes, and heart condition. August 27th, he was admitted to UCH for shortness of breath. RAT on August 25th was positive. Oxygen in blood was dropping, and he had to be administered high concentration oxygen. He passed away on August 27th. 83-year-old male with colorectal cancer. On July 16th, he was admitted to QEH for diarrhea and low blood pressure. His condition was actually caused by bacteria in blood, and blood pressure dropped. His condition stabilized, and he was transferred to Wong Tai Sin Hospital end of July. And on August 1st, 4th, and 26th, he had PCR positive results with high CT value. His condition on August 27th, he suffered from a shock, and he passed away. 91-year-old male, no vaccination record, with nasopharyngeal cancer and fibrillation problem, and he was admitted to QEH with pneumonia, and he was transferred to North Lantau Hospital for recuperation. On August 9th, he was sent to North Lantau Hospital. His condition fluctuated. On August 14th, he was sent back to QEH. On August 26th, he tested PCR positive. His conditions deteriorated gradually, and on the 17th, noon time, he passed away. 94-year-old male with 2 shots and with anemia. He was admitted on August 19th to Yan Chai Hospital with fever, and he tested PCR positive and also pneumonia, and his condition deteriorated, and he passed away on August 27th. And the next 5 have nothing to do with COVID. a 2-year-old male with a heart condition. August 26, he was admitted to UCH for a wound in the head after falling. The brain scan showed hemorrhage. He was admitted to the surgical ward in QEH. PCR tested positive. His condition deteriorated, passed away on the 27th of August. 67-year-old male with 3 shots. He suffered prostate cancer. August 5th, he was admitted to Tinshui Hospital for weakness and also hitting his head. He was admitted to oncology in Tumon Hospital. On August 15th, he tested PCR positive. Thereafter, on August 26th, his condition suddenly deteriorated with a drop in blood pressure, probably because of internal hemorrhage, and he passed away on the 27th of August. There are 3 patients who tested positive in the A&E. 60-year-old male with 2 shots. He was sent to Yanchai Hospital, A&E, and he tested 80 positive. 66-year-old male with 3 shots with high blood pressure, and he passed out on the street and was sent to PYNEH, A&E. He tested 80 positive. He passed away on the 27th. 80-year-old female with 2 shots. He suffered from abdominal pain, and she was found to be unconscious, and she was sent to A&E at Kwonghwa Hospital, and that was on the 27th of August a.m., and resuscitation failed, and she tested the PCR and RAT positive, and on August 27th at noon, she passed away. In terms of staff members, there were 133 new COVID cases. 31 have returned to their posts. Short in Cheshire recuperation ward, there is a patient and an assistant who tested positive on 22nd of August, and 3 patients between 86 and 98 tested positive, and they were sent to Shartin Hospital in stable condition, and the staff member is also in stable condition. We are trying to establish the link. The ward has stopped taking on new patients and is also undergoing disinfection. And in terms of adjustment of services, the HA would like to make the following report. Because of the upsurge in cases, we have to focus our resources on the pandemic work and to enhance the designated clinic and the tele-consultation service. Some of the GOPCs will have the services adjusted. Some of the consultation time will be suspended or reduced. And the list of clinics that are affected, and also the medical refill clinic list will also be made available for episodic patients. They can seek medical attention. For those with an appointment, they should turn up at the appointed date with the appointment slip and the ID card to the refill center for the refill of medication. Other than GOPCs for public hospitals, because of the resurgence in cases, the elective surgeries and the day care services, we also see the service reduced, and some of the surgeries will have to be delayed, and we are focusing our attention on fighting the pandemic, and we have to adjust these services. The HA will continue to monitor the situation and the demand. If the COVID conditions worsen, the HA will need to reduce the service and redeploy the resources to battle the pandemic. So once again, I'd like to urge the members of the public not to take this virus lightly. For those who are unvaccinated, they should go get the jab, in particular senior citizens and the children. And the members of the public should undergo testing. If they have symptoms, however slight, they should seek medical attention to prevent the situation from worsening. Thank you.
Good afternoon. Yesterday, we had a total of 9,495 local COVID cases, PCR positive cases, 2,930 RT positive cases that are verified. 6,565 cases. There were 213 imported cases, 186 cases PCR positive cases, and 227 RAT positive cases. Among the 213 imported cases, there were 89 cases picked up at the airport specimen collection center from day 1 to day 3 at designated quarantine hotels and quarantine centers. 60 cases were picked up from day 4 to day 7 at community testing centers. There were 51 positive cases picked up from day 8 to day onwards, that is from day 8 to day 10 at testing centers. There were 13 positive cases. Most of the cases had a higher CT value, possibly repositive cases. Among the 213 imported cases, they come from 55 places. 6 places each contributed more than 10 cases. 25 from India, 20 from Thailand, 18 from the Philippines, 16 from the UK and the US respectively. Singapore 11, 12, and then for the rest, each place contributed fewer than 10 cases. Just then, Dr. Larry Lee mentioned 10 deaths reported. In total, there were 9,451 deaths in the 5th wave of outbreak. For care homes, some care homes reported infections yesterday. Some residents need to be quarantined. At Hong Kong Lutheran Social Christian Service, Wong Chen Lam second elderly home in Sai Kung, 1 resident got infected. 3 residents need to be quarantined. At Yun Yun Care Home, elderly care center at Shunning Estate, 1 resident got infected. 2 residents need to be quarantined. At Methodist Long Yet Care Home, 2 residents got infected. 5 residents need to be quarantined. At New Life Psychiatric Rehabilitation Association at Halfway House, which is in Sam Shui Po, 1 resident got infected. 3 residents need to be quarantined. At Caritas Lok Chong House in Yao Chin Wong, 1 resident got infected. 4 residents need to be quarantined. It's Sunday today. There are no classes. No additional school needs class suspension. In terms of mutant strains, for suspected BA.5 and BA.4 cases, the ratio has risen again. For the specimens collected on August 25th, the percentage has risen to 50.5%. For suspected BA.2, 12.1, the percentage remained at around 7.7% at a lower level. That's all from me for today. The floor is now open to questions. Before putting your questions, please identify your media outlet. On the left, the gentleman at the back. I'm from Phoenix TV. For the confirmed cases today, it's closer to 10,000. When can we expect the daily case number to top 10,000 cases? What contingency plans do the authorities have? Yesterday, the chief executive appealed to private hospitals to be more active in taking in patients referred by public hospitals. Have we made any progress on that front? Now, when more than 8 people attend a banquet or meal gathering, they have to present a negative RT result. But if these people are recovered COVID patients, can they be exempted from this requirement? A few days ago, we could see that the daily COVID case count is rising, and it's expected that the case number could top 10,000 cases per day. The government has rolled out measures that require public compliance, including for those attending banquets, they have to do an RT beforehand. Rapid antigen tests need to be done for both recovered COVID patients and others. Now, for private hospitals, as I mentioned, there were some teething issues, but we share the same goal. Now, for the occupancy rate of beds at private hospitals, out of the 360 beds, 237 are occupied. We thank private hospitals for helping us out. Next question on the right, the lady at the front, near the middle. I'm from Now TV. For the 17-month-old toddler and the 10-year-old boy, how are they doing? Now, before people got vaccinated, parents need to arrange RT for children. Some parents may have taken their child to inoculation without being aware that their child has been infected. And let me address the point about the 2 child patients. For the 10-year-old, now he has been transferred from the pediatric ICU to the general ward. He still requires oxygen support, but he's in a stable condition. For the 17-month-old infant, he's still at the pediatric ICU, but he's now requiring a lower level of oxygen support at 2 liters. The convulsion has stopped. He is still in a serious condition. So far, we don't have evidence suggesting. Now, if you have tested positive, you should avoid going to vaccination centers so as not to infect others. And then positive cases should be isolated. We are appeal to the public to make greater use of RT. On the right, the lady at the back. I'm from cable TV. Some restaurants have placed RT kits there for the use of those who have forgotten to take the RT. Are you worried that when people do RT right outside a restaurant, that could lead to transmission risks? Just then, there was mention of the private hospitals taking in patients from public hospitals. The chief executive criticized that the private hospitals has been too slow in taking in patients. Is there any way to speed things up? Now, we haven't come to the point when case numbers tops 10,000, but the public hospitals are already scaling back GOPC services. At which point, in terms of the daily case number, will there be further cutbacks to public hospital services? And we appeal to the people to do their RT at home or do it at a place where other people can see them. After all, they have to take off their masks to do an RT. For private hospitals, there were teething issues. And there was some coordination or communication issues that may have taken some time, but as we are more familiar with the process, things are going more smoothly. We share the same goal. That we shouldn't be too worried too much about who's to blame. In terms of the GOPC services, the things are different now. We now offer teleconsultation services for designated COVID clinics and teleconsultation services. They can help those staying at home, seniors, or other vulnerable people. Such services offer help to these people. In phase 2, the quota will be around 2,000 places, from 1,300 to 2,200. We are now in phase 3 of the plan, so the quota will be increased to 3,000 places. In the days to come, if the demand keeps increasing, we can further adjust the services. So there's no rigid number in terms of at what some point we open up more designated clinics. But if there's a need, we will deploy resources flexibly in terms of the COVID clinics and teleconsultation services. Next question on the left, the gentleman in the shirt. I'm from TVB. A question about where COVID is going. Today, the case number may exceed 10,000 cases, but the schools will start again, and there will be more people out and about in the community. So the case number may not stay at 10,000 cases per day or so. The authorities have said there would be targeted measures, so there may not be across-the-board tightening of restrictions. But which area should we see more restrictions? Are you worried that people are feeling helpless and people are skeptical about such measures? A question for the hospital authority. There were some cases involving seniors. People caught COVID, but then they were transferred to places like the North Lantau Hospital, or they're transferred to other hospitals. Will there be adjustments in light of such cases? For people of an advanced age, would you wait till they are clear of the virus before transferring them elsewhere?
Well, with the commencement of the schools, I may not have anything in particular to the COVID situation, but schools are places where people gather and there is a likelihood of transmission. And every day, the teachers and students will have to conduct RAT tests in order that the virus will not find its way into the school compounds and cause a spread. In terms of COVID, if patients are becoming stable in their conditions, they will be transferred to the convalescence bed for rehabilitation. I think the same workflow would apply to the COVID patients. Now, say, for instance, at the Princess Margaret Hospital, if one suffers from fever and the problem of bacteria in the blood, and the conditions become stable, and he would need the rehabilitation service. He is transferred to the North Lantau Hospital, and this is for the rehabilitation of the COVID patients, and this is a reasonable transfer. Next, please. Let's turn to an English question. The lady on the right, please.
A few questions from the SCMP. So as the infection figure has exceeded 9,000 today, would the CHP expect the figure to reach 10,000 in the next few days? And as the proportion of BA.4 and 5 have surpassed that of BA.2 on August 25th, would the CHP declare that the BA.4 or 5 is a dominance of variants now? And how many people have been reinfected during the current wave, and how many of them were infected with BA.2.2 during the fifth wave? Thank you.
So the figure of the confirmed cases is still increasing in an increasing trend with recent more faster rate, possibly due to the increasing proportion of BA.5 variant or Omicron variant. So the numbers exist 10,000 is as expected in the coming days. So you asked about the proportion of BA.5. For the figure on the 25th collected by our laboratory, the proportion is already 50.5. And then the proportion of BA.2, 0.12, 0.1 remain at around 7%. So that the other slightly BA.2, 0.2, so it's around 43%. So now the predominant strain is already suspected BA.4 or 5. But we still need to observe for one or a few more days to see the exact trend. Around 1 to 2%, around 1%, less than 2% of everyday cases, we consider them as reinfected cases.
下一題，左手邊。
Next, the one in white T-shirt on the front row. AM 730. About the disease case, the second 185-year-old male. He was admitted to hospital for 1 month, testing positive on 3 occasions. On the 1st of August, was it high viral load? Was it and transmission infection in hospital? You mentioned 364 hospital beds. How soon will the beds be increased? And do you have to make the proposal? And how does it work in terms of bed increase? Designated clinics, you mentioned the suspension of some of the GOPCs, and how many patients are going to be affected? Now, for designated clinics, this will be provided together with the tele consultation. Now, what criteria do you have to increase the number of designated clinics, and what is the utilization rate on a daily basis for these two types of services? And you will concentrate on manpower. How are you going to ramp up the service in these two areas other than increasing the quota? Right, first of all, about the private hospitals, I don't have any timetable regarding the increase in the number of beds. I'm sure that there will be discussions going on. You refer to that particular case. I think it is the 83-year-old male. Now, that patient suffered from the colon cancer. He was treated to QEH. His condition was complicated on August 1st and 4th and 26th. He tested PCR positive, 35 and more than 30 in terms of CT values. Now, we looked at the situation. We believe that there was a late-stage case, and it probably was a case of another infection. We're not sure whether there was an infection within the hospital. We're inclined to believe that this is not. Now, for the GOPC services, and they have to be adjusted because we need to devote the manpower to the teleconsultations. I don't have the precise manpower statistics with me for the time being, but we are deploying the manpower in the third stage response. We're moving up from 2,200 to 3,300, and where necessary, the number can be further increased. Now, you may ask whether we need to have more physical clinics or whether we need more in the way of teleconsultations. Now, the situation is not particularly stable, but once we have started the teleconsultation service, the response has been pretty good. And this has been very helpful to the patients, and that has actually taken the burden off some of the designated clinics. Utilization, I'm afraid I don't have the number. Let's make it the last question, the one in the middle. Doctors, Ming Pao Daily, if I may put this to Dr. Larry Lee, for the hospitalized patients not in the second tier, and also the AWE or North Lantau, what sort of patients are they? How to arrange for their facilities? Do they need any negative ward? In terms of deployment of hospital beds, will you be making available a whole ward and turn it into negative ward? And how many staff members are infected, and how many have returned to their posts? For the GOPCs, some of them have been adjusted. How many patients are affected? In terms of private hospitals, now where you are transferring some of the patients, have there been any discussions regarding the types of patients to be transferred? The surgical patients or convalescent patients, what sort of patients are going to be transferred to the private sector? Right, for the private hospitals, we have been having discussions. We've been focusing on the non-COVID patients, and the TMHK can admit 24 patients. We don't have any particular restrictions, but basically they are stable patients. Whether it is a medical ward or surgical ward, they will be covered, and it would cover a broad spectrum of patients. In terms of GOPCs, I don't have any particular statistics regarding the anticipated number of patients who are going to be affected. Now, in relation to the deployment of beds, there are many considerations on the part of the clusters. They have to consider manpower. They have to consider whether the ward can be converted into an isolation ward. There are so many considerations to take into account. The North Lantau Hospital, ICC, and AWE, they do complement one another. At the HK ICC, they have 750 beds. AWE, there are 200 beds in operation. Now, our focus of attention is to admit patients transferred from the hospital. They are COVID positive patients that are not fit for discharge. When they are transferred to these hospitals, we will be able to offer them treatment and also other services. In these two community treatment centers, they are more like hospitals, and there will be doctors speaking their rounds, and there are X-ray and blood taking services. For the AWE, as we mentioned earlier, in the community there are some senior citizens who will be sent there for isolation and for treatment, and also for the community isolation facilities like Penny's Bay, if there are complicated situations, if patients do need more care, they can be transferred to the AWE. So for these reasons, the number of patients is creeping up steadily. We have about 800 patients there already. That's it for today. Thank you all very much.